Good afternoon, everyone. I'm calling to order this meeting of the Dunn County Health and Human Services Board for October 27th, 2022. Let the record show that all of the supervisors are present. Thank you for that. Ms. Barker and Mr. Lamb are here. Dr. Hall is at her son's state music competition. He's a very talented musician. So Gavin, we need to look at and approve the meeting minutes from September 22nd, 2022. I could use a motion on that. Supervisor Hagan, Ms. Barker seconds. Any additions or corrections to the September 22nd meeting minutes? If not, all in favor of approving the minutes, say aye.
Aye.
Any opposed? Minutes are approved. We do have a public comment today that I've asked Ms. Winter to share with us. It was received via email this morning.
This is an email from Terry Nichols, and it is regarding nitrate tracking and CFOs, I believe that's pronounced.
Correct.
Public comments for the Health Committee. Living in the town of Colfax, we are completely aware of nitrate levels as these levels have been exceeded in areas. If I focus on environmental health in combination with how CAFOs expand their dairy herds, the only way a confined animal feeding operation CAFOs can expand the number of animal units is to acquire more land to spread their liquid manure. I have observed over the years that these CAFOs either lease or rent land for this purpose. These additional fields can be next to existing rural residential housing. I am not aware of any programs that address testing of the wells in that area. What I consider more harmful is the spreading of human septage on farm fields. I took it upon myself to contact a state department to find the locations of the spreading of human septage in Dunn County. Long story short, it would cost me for the DNR to do research. I can't imagine what is in human septage. I would think any county health department in the state would have access to this information. I know that COVID has had a profound effect on health departments across the state. I also know that most cases there is not enough personnel to handle it all. I don't know how any county health department can monitor rural wells adjacent to fields where land spreading of human septage is occurring. I know that land conservation is involved in Dunn County, but does the environmental health department enforce more stringent rules or processes related to monitoring nitrates and other pathogens that most people aren't aware of? We've already been through the governor's year of groundwater. Has it been changed how the county health department addresses issues? Respectfully, Terry Nichols, Town of Colfax.
Thank you. We don't generally respond to public comment, at least in this forum, but I am going to suggest, and I will share this with Mr. Nichols, that if you recall, we are spending some of our ARPA money for a comprehensive well testing initiative. The announcements about the voluntary initiative are ready, and they're about to go out. They're going to be moved to town halls, to local voting places, and it'll be distributed fairly widely so that individuals such as Mr. Nichols can arrange to be part of the well sampling. There is also regular well sampling at village halls and other campgrounds and other public places. And Katie even had some of that in her report this month. So we are, I mean, it's a big job, but there is some work that the county is doing on nitrate and other substance monitoring in groundwater. So thank you, Mr. Nichols. Review of the next meeting date. If you read that carefully, you'll notice it's December because our next scheduled meeting was Thanksgiving. And we actually did just exercise a command decision to say that we could probably dispense with a November meeting. So unless anybody wants to gather here on Thanksgiving Day, voluntary to cook for the group, yeah, we will, yes. Otherwise, we'll see you on the 22nd of December. we don't have any budget adjustments or anything that it looks like we would have to act on in November. So it looks like we're good. Okay, I asked to bring back, just for your review, the legislative agenda, which will be shortly submitted to the legislative chairman, Ms. Supervisor Steen. We just had a couple of, we went through each of the items, Gary, at our last meeting, and only had a couple of changes and on item H, item I, and M. Otherwise, the group approved each of these. I wonder if there are any additional comments or additions or corrections before we pass this on as a committee. All right. There we go. Veterans Service Report, Greg, it's up to you. Thank you.
All right, good evening, everyone. I'll start off with the memo sheet that just kind of gives a quick narrative of activities through the last month. Local, and I think I touched a little bit about our partnership with the local 434 Pipe Fitters Union last month, and just to kind of revisit that again to identify that we had 13 veterans or surviving spouses furnaces that were checked, and I think I'd also identified that one furnace wasn't properly installed, but I had more just discussed that, so I wanted to make sure it was of record, paper record. So I put that down on here. On the 29th, went down to UW Stout, and again, I'd mentioned that at the last month's meeting, but to make sure that it's down in print. And so today, given an update, I met with Health and Human Services staff this morning. We had we were fortunate enough to be able to do a brief. It was regarding veterans experience. I talked about the partnership we had with UW Extension. It's been probably over a couple-year project. There was an innovation grant that was secured to help support that, and so the Health and Human Services staff was able to see kind of in a partial hybrid in-person environment this morning. I think that it went well. Hour and a half's a long time. So we did a little debrief afterwards just to try to condense it, because we're gonna the project has been put forward by UW Extension staff to be able to brief at their fall to see if it would be one of the projects considered. So I'd agreed to help provide that brief. There's like 3 different formats they can provide that in. So I think it went well. I mean, fortunately here in Dunn County, I think that departments in the helping professions work well together. You know, when there is well knowledgeable, but there's been a lot of new staff, and so I think there's a lot of new faces that I seen in there. So I think hopefully there was a couple takeaways from that for everyone. So I thought that was good to be able to do that, and it's something that, same as I'd kind of identified as we did this with the Menominee Police Department as well as Dunn County, that it should be something we should look at trying to do it on an annual basis, just for knowledge purposes, and to also identify how we can be of support and how they can be of support to us. On the state benefits side, I had inserted some information regarding $10 million that the governor has announced to help with Wisconsin veterans, most specifically for county veteran service officers, and in the document that I put, TVSO is a tribal veteran service officers. There's $1.5 million that is going to go for those organizations, programs. How that's going to look is yet to be determined. The Secretary for the Department of Veterans Affairs was at our conference and talked a little bit about that. So there's going to be more to follow. The end hope is it's to support outreach. Suicide is a big topic, and to be able to support offices doing more, especially with the increase of the PACT Act. We're anticipating quite a few more contacts. So that's great, welcome news, but just because there's an announcement of funding, not identified yet how it's going to come down, that's something we're just going to keep a keen eye on. Certainly we'll hear about that.
Yeah. Yes.
Would you think that will be handled on the amount of volume that each office handles? Is that how they traditionally divvy the money up?
Typically how they've divided things up in the past, using the same model as the current county veteran service officer grant. It's based upon county population.
Yeah.
And the unfortunate thing with that model is some counties, as your northern counties, if you look at a veterans population in comparison to overall population, they will run a higher percentage because of some of the retirement communities. But I think it's still a method that is applied equally. And so I anticipate, if I was to guess, I anticipate that same methodology being used, and possibly plussing up the county veteran service officers grants. There's some accountability and reports that we have to do back. That would make sense, but we'll see how it. I don't think they're just going to send us a check without any accountability.
And thank you, Supervisor. And I was going to ask you if some of these other programs those monies will come in the form of a grant, or you might have to apply, for example, for rental assistance for homeless veterans.
What I anticipate there is that there'll be a money applied by the state for the state, because they have a couple programs. One is called Veterans Outreach and Recovery Programs. So they have some dedicated staff that are working on that. So I anticipate that's how they'll use some of that. And they are partners. They're our first point of referral, them as well as Center for Veterans Issues, because they're more the emergency program on that. And we have to know what they're going to do before we're going to layer money on. Okay.
Thank you.
And one other, I think, good point is this is in response to, I think it was last month, I provided a copy of the Blue Ribbon Commission report. And there was some identified, big report, but in the end identified a number of priorities. And this was one of them. And so, but they're using the American Rescue Plan Act allocation. And I think that's money at risk, because it's not always going to be there. And so this year this is what's identified. So again, this just things for the future that we'll be looking at. Be great for right now, but to plus up things, it certainly would be nice to be able to continue that without having some additional funding for activities and then have it removed. So I'll continue to track that and report on that. Regarding the federal benefits, you should expect each month kind of an update on the rollout of the PACT Act and information that we continue to learn regarding that. We're already seeing the Veterans Administration is processing applications. We've been submitting them already. They're short-staffed. And I think they're same challenges. So we had some briefs from the Milwaukee Regional Office director, and they're the same personnel challenges that most organizations have right now. So I just met with this afternoon helping an individual out with some benefits, and he's a VA employee that has a position that's with a lot of responsibility, and he indicated they're starting to centralize their human resources functions, which is just kind of a model that the VA has moved towards, with having like a national work queue, as well as like centralized activities, which in theory for some organization it could potentially work good, but if you have a high performing area, which Wisconsin and the Veterans Administration office out of Milwaukee has always been, it takes away from the quality that we're used to when it moves to just kind of gets spread out. So that's concern. And what he had kind of expressed, it does take a long time to bring on staff. And that is something that's open in the media that they're trying to address as a whole to onboard people faster. So I anticipate some backlog as we continue forward. But as I've identified before, if you do a good job on the front end, less of a chance it's going to be backlogged. On the financial side, still at this point, I know we're in the last quarter of the year. There's no challenges or issues that anticipate with the budget. There's in the three cost centers that we have, the operations cost center, as well as we have a soldiers and sailors relief, a veteran relief cost center. We still have adequate funds in there, and that's we'll start preparing to ensure that, because we have some purchases preparing for 2023 related to Memorial Day activities, and then with the Veteran Service Officer grant, we still have some funds left in there, so we don't anticipate any challenges at this time with that. The last item I'll cover is our activity report, and so we just try to quantify the best that we can, so we have an apples to apples comparison about activities and contacts that we do within our office to be able to, again, show and support things. And so with the September numbers, kind of just relating to the impact statements, there's number 3, and benefit specialist Jessica, she pulls this report, and that was, she kind of pulled out and identified just a number of contacts. But I wanted to put that in context, like what is a contact, because I don't want it to make it in any way to look like, oh, there's 989 separate individuals. So contacts identify amount of time spent, and those are typically when we meet with an individual or a family, it's an initial, it's an hour and a half time. But within that time, maybe preparing 2-3 different forms. Leading up to that, you have 2-3 different phone calls each time you're on the phone. And so to kind of capture all of those activities, and that doesn't in those content does not count the medical equipment phone calls, because we don't capture this. The information that's on here gets pulled out of just the veterans management system that we use, because we can do a comparison report month to month. When it comes to medical equipment, we only capture if a piece of equipment goes out or comes back. So just to identify the flow, and I think it's rather consistent. And if the months we compare to previous years, there are certain times that you can see there's a little bit less contact in comparison to other times. And this is the time of year when we should see a little bit of an uptick. Anytime we near a recognized veteran related holiday, there's lots of questions. A lot of people have those individuals on their minds, and so we'll get a lot of questions and walk-ins and stuff. So just to kind of throw that out there. Last week was elected to be the second vice president of our state association, which is good. The good thing was it was an act of there was competition, so which is a good thing on an association level, because people have choice. But the good thing that I think they had decent choices to make. But as an association, there's always instilling different ideas, different vision, or a change in vision can sometimes be threatening and stuff. And so but making sure, so some of what I've expressed to the group is just identifying what any type of internal threats, external threats for the organization, and make sure that we are hitting them head on. And the number one thing is the quality of work. And so that was kind of my vision and platform. If you do a good job with what you're supposed to do, there's less of a chance there's any type of internal threats or even external threats. And so it's training is important, quality commitment. And I also delivered the ethics and conduct training for the group. It's mandatory to go through an hour of ethics training. And so it was actually good on the level of preparing a presentation on ethics, because you have to dig into the Code of Federal Regulations that govern what we do. And you only have an hour, you spend 30 minutes on how do you lose your accreditation rather than how do you do a good job. Like, here's the things that can have you lose your accreditation. So I was glad to do that when they asked me to do that, just because I think that some of that conduct is important. So, and then the other thing, kind of in response to a lot of military sexual trauma claims that have come our way, and we give a lot of referrals to the La Crosse Vet Center, who they go out and do counseling. What they've decided to do, they had a number of individuals that we referred that are at the point in their lives where they're okay with being in a group setting, and so they're working on, and they've had a couple military sexual trauma or MST groups, which I think is a good direction, because then people know that they're not alone. That concludes my report. If there are any questions.
Any questions for Greg? And congratulations that others are recognizing your leadership. We had no doubt about it around this table. Supervisor Steen.
2 questions there, Greg.
Yes.
I see our total pending claims are inching up. How's the response and turnaround or decision making on that type of thing?
With slower but inconsistent. So I know that's kind of a middle of the ground political answer, but it's just inconsistent. Sometimes, surprisingly, when I'll do a claim and tell an individual, here's the expectation, 30 to 45 days, you'll get a letter saying they got it. You'll probably get an exam, 120, maybe 150 days out, but they'll get a phone call the next week to come in for an exam. And then there's others that will have that they'll be sitting in a ready for decision phase, which is the last phase where all they're doing is getting ready for a notification letter. So I anticipate that to be getting a little bit more slowed down, because the number of claims going in nationwide should trend up because of this PACT Act. And they're not, the VA has been working on being prepared for this since the first of the year. This hasn't come as a surprise, this PACT Act. So I think there's going to be a little bit of a slowdown, but I think that they're better prepared than they ever have been as an organization to respond to it.
The second part of my question is, how do you find the competency of the people that are making the decisions? Are they well versed and know their stuff, or are you finding variations there too?
Variations. So the way that I would assess that is based upon the number of clear and unmistakable errors. So there's decisions that are made that we just don't like. Yeah. Our interpretation is different than an individual based upon the evidence, and we believe there's equipoise or equal weighted evidence. But there's been less where I've submitted clear and unmistakable error, that where they will say, we're denying this because you never served in the military. And we have to say, well, what is this retirement order, from 30 years? What evidence is that? Does that help us? So there's been less of those.
Okay.
But that's why there's like 4 different appeal levels because of that. But I haven't, last year I put in a heck of a lot more clear and unmistakable errors than this year.
Yeah. My last question is, really, it is my last one.
Okay, that's good. That's good.
How are you batting on your appeals? What are you hitting? 500, 750, 450? What are you hitting?
Boy, I don't have a number, but I would at the so there's three levels that we can come up with a number. I don't have numbers, but there's a higher level review where we get a phone conference to point out where they may have erred in interpretation of a federal regulation. I would just out the chute, I would guess that we're probably shooting 50% on those. Then above that is a Board of Veterans Appeals hearing. And there's 2 ways to approach that. One approach is if you're solid on your evidence and you just disagree with the less experienced employee that's not a veterans law judge, you can package it up, send it in, and they do a paper review and they can turn it. Usually those are higher percentage because everything is right there. We're confident in those. But when we do the in-person hearings, those ones I would say probably 30 to 40%. And I think I'd say we probably run the same. Last week in the briefing, I think at the Board of Veterans Appeals, I think nationwide, it's about a 30%. And don't necessarily quote me on it, but I believe it was around 30%. And then those that get denied, you can take it to the Court of Appeals for veterans claims. So
thanks, Greg. It's my last question.
Thank you, Greg. Thank you, Supervisor Steen. Any additional questions for Greg? No. A good report. Thank you very much. Next up is the Department of Health staff report. KT is not feeling well today, so she is virtually. She has several staff members here. And because later in the agenda, we're going to look at an ordinance amendment regarding environmental health, I asked that KT do a bit of an update for we as board members about the environmental activities of the health department. So KT, it's in your court.
Thank you very, very much. I wanted to just share who all was with me today. So Jeff Robb is our environmental health manager. Carrie Quilling is our nursing manager. And we do have Amanda. She is finishing up her RN to BSN. She's an intern with us, finishing her clinical rotation. So just so you see, have faces to go with the names.
Welcome, everybody. Thanks for joining us.
Yeah. So I'll go ahead and share my screen. I sent this out in an email yesterday. Oops. Paula, can you enable screen sharing, please?
Is that working?
There we go. Perfect. Okay. All right, so what you're seeing right now, I just wanted to start with our normal update and give a little nod to hopefully some sweatshirts you saw, or crew necks, I guess they're called currently.
We've already sold several.
Wonderful, wonderful. I just wanted to share that we did a fundraiser for Health Done Right, and then we had a little get together to support that as well. So fun story. The company that we used to promote, to print the crew necks sent us the wrong ones. They were actually for a beer crawl out of Indiana. And so when we called to let them know that it was the wrong one, they sent a new one right in the mail. And then lo and behold, we received our actual crew necks about 4 days later. So we ended up with a double batch. So really happy that Custom Ink made it right. But as a result, we have some additional fundraising materials. So I thought I would share that with you.
So now we need a double batch of fundraising. Yay.
There you go. There you go. I also wanted to share that there were a couple typos I wanted to, and it was no fault of our nursing manager. It was absolutely on me. We actually are seeing an increase in our AMI over our vaccination contractor AMI for COVID shots. From last month, we were seeing about, not that many, up around, 10 or so. And then this month, we're really seeing more like 20 to 30 folks coming in each time. And we're hearing from them that some folks are finding some challenge in finding the type of vaccine that they want to use. And so the nice thing about AMI is that they meet people where they're at, and they carry everything that is approved for use, including the Omicron booster for children 5 or 6 and up, depending on the formulation that people are looking for. So I wanted to make sure you guys had that in hand. Okay, and then Supervisor Morehouse had asked that I give a little overview on environmental health programming here in Dunn County. So I sent this out via email in yesterday, or I believe yesterday afternoon. So I'm just going to make it a little bit larger so it's easier to read. I wanted to go through our mandated environmental health services, our revenue generating services, and also our grant revenue generating services. Jeff is on the line just in case you guys have some tricky follow-up or I don't get something just quite right. So with our mandated environmental health services, by statute, we're required to follow up on communicable diseases to prevent outbreaks. In addition, we're also required to follow up on human health hazards, and that includes lead poisoned children, harmful algal blooms, and unsafe living conditions. Those things are not necessarily funded. They have a small amount of grant funding towards them, but it's largely an unfunded mandate. When we look at our revenue generated services, these are not things that we are required to do, but that we choose to do. One, because it gives us some local control. DATCAP, the Department of Department of Agriculture, Trade and Consumer Protection, would do the inspections for the licensed facilities here in Dunn County, but we feel that we can have a more local touch and be more timely in those inspections. So we have had this program here in Dunn County for almost 30 years. In addition, we also do safety and inspections in recreational facilities. And when I say that, I mean pools, body art facilities, hotels, and campgrounds. Again, DATCAP and DSPS. Some people say it DSPS, but DSPS would do those inspections, but we have more local control in doing them here. We also have a couple well water safety programs. Both are not required, but again, it's a revenue generating service and allows us to have a little more local control. That's for our transient non-community water. And that's for the types of facilities that serve at least 25 people, different people typically, for at least 60 days of the year. And so thinking about gas stations or campgrounds, those kinds of folks are required to have a TNC license. We do sanitary surveys for those locations, as well as annual water sampling. And then finally, we also are part of the DNR's delegated well water program, and that's for initial private wells to make sure that they're installed in accordance with the code and following up on unsafe initial well water samples. And then for our grants, we are a regional radon informational center. And so what that means is that we're provided with some grant funding from the state to have a higher level of expertise around radon and radon mitigation. As you guys will remember, radon is a colorless, odorless gas that is the second leading cause of lung cancer behind smoking. It's naturally occurring, and the only way to know if you have it in your home is to test. And so Jeff and his team We'll work to support other counties, 5 other counties, and consumers from those counties to provide information. So that's a snapshot of our environmental health programming. Any questions on that specifically before I jump into other update items?
Supervisor Steen has a question. Supervisor Steen.
Yeah, this is for Jeff. Do you do nitrate testing on pivot point wells, or is it just home wells?
So we don't do nitrate testing for pivot point. Most of our nitrate testing that we do is through that TNC program. So the churches, bars, restaurants that are on private wells. We do have fee exempt kits for pregnant mothers and children 1 and under that they can test their private well for free to see what their nitrates levels are. Obviously, because nitrate is a big concern for those pregnant mothers and young children.
Thank you.
And Jeff, now that you've got your certification, I think that this is a wonderful example of cooperation between environmental services and the health department, that you're now able to do septic inspections, and will save us spending a lot of money on external consultants. So I really welcome that. That's very good news.
Yeah, and I think it's good to have. I've seen we've had a good relationship with zoning and with land conservation here at the county, which isn't always the case within public health departments and other counties. So it's good to have a partnership and to be able to work together.
Yeah, that's good. Thank you. Any other questions on environmental health or other issues? All right, KT.
All right, so I'll just go back to a couple of things that you had in your packet, either to start our, let's see. So I gave you guys quite a bit of advanced reading to share a little bit about, let's see. Let's see. I wanted to give you guys, so the flu report has not come out, but there is a lot of conversation about respiratory illness nationally, and that's manifesting in our local data as well. You'll see that we have seen a significant increase, and this is in the state of Wisconsin in RSV. So that's the percent positivity, the number of tests that they're doing. So they've already excluded COVID and influenza. And then we use that second tier of testing. We are finding a lot of RSV here in the state and locally. So I wanted to point that out. We will likely get the flu report, the respiratory virus report, starting in the next month or so. They typically start that up in December or January. I also wanted to share kind of also on the environmental health front that the state has some voluntary PFAS well water sampling that they've done as a statewide initiative. Local health departments had no ability to ask for certain places to be tested, and the state reached out directly to consumers to ask if they wanted to have their private well tested for PFAS. We did have a handful of Dunn County residents elect to have their private well tested. All of those wells came back without harmful levels of PFAS. Some of them did have a detect, but it was not at a level that exceeded the health hazard for Wisconsin. So I wanted to bring that to your attention. It was in your packet. Epi Express, again, this took a hiatus over COVID. So I'm really grateful that the Bureau of Communicable Disease is now giving some time and attention, much needed time and attention on general communicable disease issues. Come on, friend. In your packet, it's not loading very well for me, but in your packet, you'll see that there are some year-to-date communicable disease updates as well. And I think that that's helpful. And that concludes my general update.
Any questions for KT on the general update? All right, moving on to finances.
Sure. So in the packet, you guys had our summary report for finances. We're continuing to show that we will have an excess of funding. That's much of that is actually going to be carried forward because it is a multi-year grant for COVID, several multi-year grants related to COVID response. But at this point in time, we still are looking very much in good shape that way. Any questions?
Any questions on the financial report for KT? No, thank you. Thank you all for being here. This is a good report. All right, moving on to Human Services. Ms. Winter, it is up to you.
Thank you. In your packet, you would have received my report. First of all, any questions in the report before I kind of walk through a couple of the items?
Go ahead.
Okay. Just to highlight a few different areas. There was a fantastic letter that we received for economic support, and talking about the program and what it does for that individual. So look at that at the end of the report. When you look at what we're up to, there's a lot of different times of years that we have activities. So this is our contract time period where we take a look at all of the contracts that we have with providers and receive new information, update them, and do all the work behind the scenes for that. As I said in my report, there's 116 contracts at this time, and there may be additional as we continue to move forward, but that's a lot of work done by that team. And so I just wanted to recognize them with that. Also highlight the 2023 budget. We were asked by the county manager to take a look at our budget and see if there was anything else in there or any changes that had been made. And we did receive another year of the Family Treatment Court Grant, which I think Chris told you about that. She asked and they said, yes, we can renew that. So it was a great ask, and she nudged me to say, make sure you ask again next year. But with that, we were able to then go back and come in, at a 0% levy increase, where before we were asking for some additional funds. So that was great news. And we were happy that that could happen. So that part of that. I also wanted to just do a shout out to the Veterans Office. As Greg had mentioned this morning, he and Jessica, the Extension Office, and a health officer from Jackson County, I believe, our extension officer from Jackson County, presented to our department staff, and it was a phenomenal job. It was really exciting for me to watch the interplay between the Veterans Office and our staff in our department. It demonstrated the collaboration. Both Greg and Jessica called a lot of people by name. You could tell that they worked together well. The department staff made several comments about the great work of the Veterans Office and how they're able to do warm handoffs of individuals working together. It also provided a lot of education and is one of those trainings that make you think about things that you're doing and how maybe you could do that practice a little bit different to be able to help the experience of a veteran to be positive or to reduce some of the anxiety or trauma of veterans. So it was recorded for staff that couldn't be there. And I did mention to Chris, I would like to see this, would recommend that it's showed or trained to other staff in the county, because I think it was so well done. And there's a lot of different departments that, work with veterans. So very well done, and very appreciate that training for us. With that, I don't have any other comments unless you have
any other questions or issues for Ms. Winter. Okay. How about finances?
Sure.
Yay.
Yay, that report is in your packet as well. Yeah, this is really good. Looking at that 1.5 million that we are looking at projecting to have in excess by the end of the year. And, certainly that can be change drastically by somebody in placement or those kinds of things, that can really make, impact our budget. But at this point, we're sitting fairly well, and that's exciting for me. And I'm assuming you as well. Any questions on that?
You did mention last month that there's an individual and long-term placement that's pretty expensive. Do you think that's going to affect this in any way?
Well, we have, such a short time in the year left.
I know.
So it's gonna put a little bit of a divot in it, but not significantly. You're gonna see this, pretty close here. If we're looking at potentially lengthy into next year, that could really hit us hard, but
yeah,
I think we'll be okay here. But yeah. So.
Supervisor Steen.
What is that individual costing us a day? Do you know?
I don't know that cost. I can get back to you on that.
Yeah, I just ballpark figures at the 500 or the 1,000.
I don't know that. I'd have to go back and look at that for sure.
It's a lot.
Sorry about that.
Yeah, it's a lot.
Yeah,
it's a lot.
I'll have to pull the numbers.
So I just want to make sure that Sarah Stabenow hears this, and so I can go and tell everybody we're going to give a 1.5 million back. Huh?
Well, at this point, that's what it looks like we're projecting. So
you can say that we're hoping
Yeah.
to return $1.5 million to the
I'm
levy.
just saying that to pull Sarah's chain. That's
I don't think Sarah's.
She's
I don't
not
think
even
Sarah's.
ready
I don't think
to
Sarah's
be
even
chain
here to hear that. You need to send her an email. Need to send her an
But-
email.
I will report out on that next month. That's a good question. I just don't
Yeah.
have it. I didn't look at it to know for sure. So
Yeah, those long-term placements are
expensive.
a burden for counties. Any further questions for Human Services? Great job. Thank you. We have a number of action items to take a look at. First is review of the September vouchers. $359,563.80. Any questions on the vouchers? This is normal and customary. Need a motion to note review of the September vouchers. Mr. Lamb moves.
I'll second.
Is that a second, Supervisor Steen? Any further discussion? If not, all in favor of noting review of the vouchers for September, say aye.
Aye.
Any opposed? All right, reviewed. The next item, and I don't know who exactly wants to handle this. I don't think Jenna is on board. So Ms. Winter or Manager Corpola, this is a request to change a job classification that comes from our movement of people back from house calls to county employment. So I will let you deal with that.
Sure. This is kind of a cleanup of something that happened when house calls employment moved over, as our chair just stated. At that time, it was missed to have this position on the classification chart. And we did have one employee that moved over with this. It wasn't a new position or anything like that that's occurring now. We are just in the process of asking for a second position in one of our grant funded programs. And so we're building on this program. And when we went to advertise for that position, we're like, where is it on the grade scale, right? So we look back at it and said, we need to, kind of fix this moving forward. So that's what this is about, is kind of taking care of that business from not having it on there and making sure that we have it on the wage scale as it should be.
All right. And there's no fiscal impact of this because it's already in the budget.
Right.
This is sort of unusual because usually the admin committee will act on this, but since they met before us, I assume that they
Yes.
I assume that they said yes to this, but it's contingent on this committee approving the amended job class. So I will need a motion.
I so move.
All right, is there a second? Mrs. Barker seconds. Any further discussion, questions, asks for information? All right, if not, all in favor say aye. Aye. Any opposed? All right, that is also approved. And do we need to do something official with admin to tell them? Or no, we're all okay. Okay. Actions to forward to the county board. We have another lengthy budget adjustment from Human Services. These are almost always self-explanatory, but I don't know if you have anything that you want to add or if members have any questions about this.
The only thing I would add is that they were additional revenues to the grants that we already received. And so because we received those additional dollars, we needed to make the budget adjustments so that we can spend the money we received.
And a fairly significant contribution, which was, yes, we need a motion on the budget adjustment to approve the Human Services budget adjustment.
I would so move.
Supervisor Steen, is there a second? Supervisor Hayden? Any further discussion? I should have looked faster. Supervisor Bresnan. Any discussion? All in favor, say aye.
Aye.
Any opposed? That is passed. And then there is an ordinance amendment, and I'm going to turn this over to KT to explain this and subsequent steps.
All right, thank you, Supervisor Morehouse. So what you have in front of you is really some cleanup. In 2018, during our evaluation from DATCAP, they recognized that we did not have an appropriate appeals process. And so one of the first things I did when I started with the county was updated our recreational licensing ordinance to include an appeals process. Unfortunately, in the process of putting that forward, literally a single sentence was dropped, and it didn't give us the ability to tailor our fees the way we might want to. So it adopted the state fees by statute or by ordinance rather, but it didn't give us a mechanism for fee setting. So what you have in front of you, and I can pull it up if that would be helpful, is, or rather in the packet, is some language specifically giving the Health and Human Services Board the ability to fee set for our licensed facilities here in Dunn County. It also spells out with more transparency the other types of fees that we may issue related to late licensure or reinspection. And this is important because by referencing the state fee structure, we may have some fees that we don't think are necessarily appropriate. For example, the reinspection fee is rather punitive. It's equivalent to a full license. And so you either have folks that aren't conducting those re-inspections. And so, you know, violations that could make people sick are going on unchanged, or it's creating a real combative situation with the regulated facility. So are there any questions about the ordinance recommendation at this time before I talk about next steps?
And I assume that everybody recognizes that the underlined text is new text to the existing ordinance, which was also in your packet. Any questions for KT about the specifics here? Okay, go ahead, KT.
Sure. So this process, if you guys move it forward, will go to the executive committee, and then it will go to the whole board, where it will have 2 readings. At that time, there could be additional public comment, and there's the ability to work through the county board process to get it ratified. If it's ratified, it'll go forward, hopefully in January. And that'll give us the ability to then come back to the board with a fee structure and policy that will help us get education out to the regulated facilities prior to us mailing out renewals. And we do that typically in May, and then they're due the 1st of July.
Any questions? I think this is a good, this is good work, and I would recommend that we approve it. I would like a motion from Supervisor Steen.
I move that we approve this change to clean up what the former chairman did to us.
Yes, I did. We did note that signature here.
Yeah,
That signature.
Second, anytime we can correct something, Gary.
All right. All right. Not necessarily pursuant to this business, but anyway, so we have a motion and a second to approve the ordinance amendment. Any further discussion? All in favor, say aye.
Aye.
Any opposed? It's will pass. And this will go to the executive committee and to the county board for further action. And unless there are any announcements, unless anybody wants to buy several more of these gorgeous sweatshirts, they're in the back of the room in multiple sizes. We are adjourned. Thank you, everybody.
Have a good night, everyone.
You too. Thanks.